Good afternoon, everyone, and welcome to this Global Fund supported webinar on leveraging the DHIS2 Maturity Assessments to strengthen global health investment cases and funding requests. My name is Nina Justnes. I work at the HISP Center at the University of Oslo, and I will lead this webinar today. Um, as the global health funding landscape continues to shift, countries and partners are facing increasing pressure to demonstrate robust digital health systems and clear investment priorities. The DHIS2 maturity assessments can be used as a practical tool to strategically inform and strengthen funding requests, build stronger arguments for investments, and support more effective dialogue with partners and funders. And today we are lucky to have ministries of health from Ghana and Nigeria presenting their experiences with the DHIS2 maturity assessments, utilizing this tool in the construction of funding requests, and share how they are approaching coordinated investments and engaging with multi in-country partners. So this is our agenda for today. We will begin by setting the stage for the webinar with a few introductory remarks by the Global Fund. Then we will have two presentations from representatives from Ministries of Health in Ghana and Nigeria. Following this, we will hear from our partners Gavi and WHO, sharing their views on the importance of aligned funding requests with the DHIS2 maturity profile. And then we will open for questions at the very end of this webinar. So please note down any questions that you have during the presentations or write them in the chats, and then we can address them towards the end. Yes, so to kick off this webinar today, I would like to give the floor to Michelle Monroe. She's Senior Specialist at Global Fund, and she will say a few introductory words. Michelle, the floor is yours.
Thank you, Nina, and hello, everybody. So very excited for this session today to highlight the use of DHIS2 maturity profiles or maturity assessments. And for the Global Fund, just want to share why we really support this activity and why now in particular as well. So we have seen in the last grant cycle, Global Fund grants going in 3-year cycles, that the use of DHIS2 maturity profiles can be very helpful for informing the grant cycle funding requests. And we are about to move into the planning and development cycle for the next grant cycle 8. And you can see the timeline here on the right. So many countries will be putting together their funding requests to the Global Fund over the next several months. And so we wanted to highlight that for the aspects of the funding request that may include requests for investments around HMIS or health information systems in general, that for countries that are using DHIS2, that doing these maturity profiles ahead of their funding requests can really help to inform decisions and prioritizations of activities for that funding request and for the dialogue that goes on in country for developing those. And related to that, for countries to utilize for aligning their partners and leveraging across multiple investments for DHIS2 and HMIS. And this piece that you'll see as we go through the webinar today, there is a nice focus in this, not just on maybe the fancier, shinier parts of the health information systems, but also the foundations that are needed to be in place or considered for the DHIS2 to be well utilized and functioning in the country. And lastly, I just want to highlight this is not, I think you'll see as we go through the webinar, this is not a big assessment. It's not a big activity that you have to spend a lot of money on, or it takes a lot of time. It's relatively short. It's something that maybe ideally you do have some TA to help with, but it also can be something that countries just walk through and answer and score themselves and use as a tool to quickly update themselves on the status of their DHIS2 and related health information systems investments, and use that to inform their planning work overall and this next year for Global Fund grants in particular. So thanks for that, and I'll hand back to Nina. Thank you.
Thank you, Michelle, for the great introduction and for the many years that the Global Fund has supported DHIS2 to strengthen health systems in countries around the world. I believe many people here are familiar with the large sort of global footprint that DHIS2 has, functioning as the world's largest open source web-based health management data platform. And the first adopters of DHIS2 was sub-Saharan African countries and India. However, as you can see on the map here, over the years, DHIS2 has become sort of the backbone of health statistics and health data management in around 90 countries. And if we include the use of private sector and NGOs, we know that DHIS2 is an active use in over 120 countries around the world. So the DHIS2 is used to collect, analyze, and present data, primarily health data, but also in use in other domains such as education, logistics, and climate health. And DHIS2 is developed, maintained, and implemented as a DPG, a digital public good, by the Health Information Systems Program, HISP, which is a global network of information systems experts, and they are supporting the digitalization and data use worldwide. And since 1994, HISP has worked with local stakeholders in low and middle income countries on design, capacity building, supporting strengthened access to and routine use of data to drive decision making in public health programs and beyond. So this HISP network that we are a part of has created a tool called the DHIS2 Maturity Profile, which is a tool to help understand where DHIS2 implementations are in terms of maturity in a given country, looking sort of holistically at the socio-technical system. So it supports countries to measure and understand if the country is progressing on health information system strengthening, and it encourage investments in core DHIS2 capacity that contributes to a sustainable health information system supporting health programs. So it encourages investments in foundational areas like leadership and governance, security and infrastructure, and it contributes to sustainable HIS supporting health programs and assist in planning DHIS2 implementations and strengthening activities. And the tool is then intended to highlight gaps and recommend activities to meet these gaps, which can then feed into a plan for the DHIS2 implementation in the country, while ideally also aligning investments and donor interventions. And like Michelle pointed out, it doesn't have to be this sort of very extensive, long-lasting sort of assessment. It's meant to give give an overview of the current situation in a country and highlighting the gaps and sort of recommend a path forward to meet the needs of the country. Yes. So on that note, I would like to give the word to our first presenter today, Mr. John Bissung. He is the Deputy Director of HMIS in Ministry of Health Nigeria. Mr. Bisang, the floor is yours. Mr. Bisang? Perhaps he is not here. Let me then jump quickly to our next presenter then instead. Our next presenter is Dr. Salamatu Togma. She is the Deputy Director of Information Monitoring and Evaluation at Ghana Health Services. Dr. Sala, the floor is yours.
Thank you very much, and good afternoon, everybody. I hope I can be heard clearly.
Yes, we can hear you fine.
All right, so thank you very much. I think that also on the call, some members of my team as well, the technical HISP team as well from the Ghana Health Service, which is the largest implementing body of Ghana Ministry of Health in Ghana. So I'm presenting on leveraging the HISP Maturity Assessment for the Global Fund, the C7 funding request, and the HMIS strategic planning as we have it in Ghana. Okay, so by way of an outline, I'll be speaking through the Ghana HISP2 journey and then the maturity assessment, key findings that were realized from the 2022 and 2023 assessment, how assessment results shaped the GC7 RSSH funding request, and then from the GC7 investment to the health information management system strategic planning, and also what the progress has been and learnings from all this process. Sorry, I'm having a little problem. Okay, maybe many of you might have heard about Ghana's HISP2 journey. So the HISP2 journey starting in 2012, where it was deployed nationwide. I think it was one of the deployments in Ghana that was done without a pilot. Usually in Ghana, when we have any information management system or any digital tool, you probably find that it is piloted. But I think this one, with this particular one, because of how important it was at the time of the implementation, we just went straight into deployment without piloting. In 2018, the HISP tracker was launched as the first tracker program and assessment, and went to implementation that began in 2024. And we speak, when we Ghana, we have 16 regions in Ghana, and all those 16 regions are regions that we are the HISP2 with our 200 and 261 districts as well. And now we have 10 plus tracker programs on the HISP2 system. When it comes to we have the HIV teaching campaigns as well, and then on the tracker, HIV, TB, malaria,
Sorry, Dr. Sala, your
electronic
sound
immunization
is
registry,
breaking up a bit.
and then I think they've actually become. Hear me now.
It's, I think you're still breaking up a bit.
Can I be heard, please?
Yes, we can hear you now. Please go ahead.
All right, okay. Let me go ahead.
Sorry, you're breaking up again. I think it might be your Wi-Fi, Dr. Sala. Apologies, we cannot hear you. Dr. Sala,
Yeah.
can you jump in?
Yeah, I think it's the Wi-Fi. She just dropped off.
Yes. Would you like to continue the presentation, or should we wait for her?
Yeah, I think she's back on, so let's see.
So please, is it better now?
Yes.
Yes, we can hear you now.
All right, okay. Yes, so I think that I was just on what our DHIS2 journey has been so far. I'm not too sure where I was lost, but from 2012, we have made so much progress up until today, having all our regions covered using the DHIS2 system with all our 261 districts as well, with more than 10 tracker programs. Can we move on to the next slide? Okay, so in terms of the DHIS maturity profile, the assessment domains as we have it is the foundational, the aggregate, and the tracker. And as I mentioned, with the foundational, we have issues around leadership in governance, strategy and investment, security and compliance, core team capacity, metadata and org units, trainings, facilities and population infrastructure. And also in the aggregate, we have the HIV, TB, malaria, EPI surveillance, COVID-19, the community health information system, mass immunization campaigns, and the tracker as well as we have it. And the scoring scores based on whether not yet achieved, whether the target has not yet been achieved, or whether you are in early progress when it comes to the area, or whether you are adequate or you are mature when it comes to that area that is being assessed. Can we move on? Yes, so in 2022, we had our first maturity assessment of the DHIS2 in DHIS2 in Ghana. And when it came to leadership and governance, we're early in progress. And the key issues that were identified were the fact that we didn't have the core team that was excluded in the technical working group. And also, when it came to strategy and investment, were adequate. We had the e-health strategy that existed, and then the HMIS strategic plan, which was outdated, that needed to be updated. And when it came to security and compliance, it was mixed because tools exist, but enforcement was lacking. And a big gap when we come to implementations of strategies in Ghana. When it came to our core team capacity, it was adequate. Capacity building plan was unfunded, even though a lot of effort had been put to ensure that capacity was built of the core team, but it wasn't funded and no one was actually planning adequately for it as well. Training end users was an early progress situation where they were ad hoc and on the job only training. A lot of times there were not planned training schedules or as part of the in-service training to train our end users on how to use the health information management system. When it came to our data quality, it was adequate. Our completeness was greater than 90%, but data use or data was weak at the subnational level. And then sustainability and funding were also early in the progress as well, mostly funded by donors, and there was really no clear plan of the country by itself to actually fund the health management information systems. Next slide, please. So these gaps that were identified from the assessment in 2022 led us into the GC7 funding request, where it had a lot of impact. The maturity assessment gaps were directly mapped to the GC7 RSSH budget priorities so that we could ensure that we were strengthening the health information system. So the gaps in terms of the core team capacity gaps, the unfunding gap and capacity building plan. The plan was to strengthen DHIS core team with academies that were being planned. And then the budget model was $2.3 million, which included analysis, reviews, and data use. And then when it came to our data quality assurance processes as well, data quality audits and developing data quality tools and dashboards was an emphasis in the GC7 funding request, with some budget allocation made for it as well. We had the gap of the ad hoc trainings and no training instances as well. And again, what was put into as an activity in the GC7 was the National Data Quality Academies that were planned and also executed, and also capacity building on DHIS2 as well. And also the budget allocation was $1.3 million for routine reporting. And then limited data use at the sub-national level was to ensure that we created dashboards for performance reviews to be able, so that you can visualize performance at every level of the healthcare delivery system. And that was, so the total GC7 RSSH M&E systems allocation was $8.6 million. Can we move to the next slide? So as I mentioned earlier, this is just a pie chart to illustrate the allocations of the various gaps and what the plan was to be able to ensure that we are able to close up on the gaps and be able to strengthen data quality, data analysis and reviews, routine reporting, and then administrative data sources issues, through our healthcare delivery system. But additionally, the RSSH investment actually also added some amount of work that was to be done in our human resource as well. So the foundation for the HMIS strategic plan was the gaps and also the progress that we actually also noticed from the GC7 grant. So if you look at the maturity assessment in 2022, the issue of the RSSH funding request, then 2024, the HMIS comprehensive review was done, and then we have the strategic plan now as well. The 2024 HMIS review built directly on the maturity profile findings, and that is the issue of system architecture assessment covering DHIS2 aggregates, all tracker instances, and interoperability issues as well. Data quality framework with 4 dimensions, that is availability, completeness, timeliness, and accuracy. To a large extent, I said before now or before the strategic plan, we had a lot of weight or emphasis on completeness and timeliness. But being able to look at all these 4 domains actually puts a lot more emphasis on quality and what people should be looking for, and adequacy as well. So, and then in terms of one of the other areas that it was built directly on was infrastructure and security audit. That included disaster recovery readiness and also alignment with national strategies. That is the e-health, the universal health coverage roadmap, the Ghana Health Service strategic plan, and then the GFRSSH KPIs as well. And then data quality improvement plan has also been drawn to cover from 2025 to 2029, which has been formulated from assessment recommendations as well. So what have been the achievements, progress achieved from 2024 to 2025? GC7 support for Ghana has yielded a lot of improvement in our data quality, in our data use, in how much totally the maturity of our health information management system. It includes 128 districts audited for data quality during our data quality audits. We've had over 100 staff from the health info, from the national, the disease program, the M&E, the regional health information officers, and even the DHIS2 core team being trained as well in data quality issues, in data audits, also in just strengthening generally their capacity. And there has also been over 200 help desk tickets resolved, and we have had the time elapsed, or the time for these help to come has actually been narrowed with the support, and then 6 programs piloted the data quality toolkit as well. So key deliverables under GC7 RSSH, the new data quality metrics dashboard rolled out nationally has been rolled out across all the regions. There is a comprehensive data quality SOP developed and disseminated, data quality improvement plan with data quality scores for the programs for monitoring. And this has been a very big eye opener for the monitoring of our programs as well, because they get to see that you get to rank the programs based on the data quality index. And then the DHIS2 country team capacity building academy, I think it has become something that our teams look forward to, because it's one of the major training and most comprehensive training we have for our health information officers. And then the automated data quality notification has also been configured in DHIS2 without liar flags, and then email alerts, which is also critical for monitoring and ensuring that there is a timely response to some of the data quality issues that may come out. There's also one of the key deliverables too has been the National Routine Data Quality Assessment conducted using the DHIS2. So if you look at the progress from what we saw in 2022 and what we saw in 2025 in terms of our maturity progress, you can see just by the coloring that we have matured a lot. From, even though when it still comes to leadership and governance, there's still a lot of work we need to put in there as well. When it comes to the strategic, and we have had some change in leadership, and this is one of the major issues that is being looked at in the whole Ghana Health Service strategic plan for the next 4 years. Strategy and investment, we have actually maintained our performance, costed work plans developed annually, and then funding remains a challenge as well. But however, we have managed to ensure that the costing plans are drawn. And then security and compliance, we have moved on from the early progress to adequate. When it comes to the core team, we have moved, we have become more mature. SOPs exist and followed, training, evaluation now systematic and all that. And then in terms of training end users, DHIS2 metadata and also infrastructure, we have actually progressed as well. When it comes to the end users, we've had 2 cohorts that have completed the academy. Now we progress. So we've had a lot of lessons learned and some recommendations. Use the maturity profile as a living document, something that we can say that this is where we are progressing from, and we can watch it over the period to ensure that we are really making significant progress as we move on. Map gaps directly to budget lines. The maturity domain translates naturally to RSSH models, and that makes it easier for us to map the budget lines as well, and then engage both technical and program teams and to be able to assess their work. They are able to look at the dashboards and see how far they are going with their work. And then it also ensures that there's ownership of action plans that are resulted from that. We also have learned to link assessment to national strategic planning. So because the assessment had been done, we knew exactly where the gaps were and the progress we needed to make. And that actually fed into the national strategic plan as well. And then demonstrates value to partners and funders. Funders can now see clearly where our gaps are, what progress we are making, what accountability processes are better, and we can ensure that they know how best to support us moving from now. Thank you very much. Thank you.
Thank you very much, Dr. Sala, for your presentation. I think we will jump back then to Nigeria and Mr. John Bissong. He is a Deputy Director of HIS in Ministry of Health in Nigeria. Mr. Bissong, the floor is yours. Mr. Bissong, are you there?
Hello, good afternoon, everyone.
Hi, good afternoon. We can hear you now. Please go ahead.
Okay. I'm Mr. John Obisong from the Nigerian Ministry of Health, and I head the National Health Management Information System in country in the MIE division. So I'll be presenting on what we've leveraged from the assessment that was done. And based on the Nigerian national priorities of also using data and digitalization as a key component of the 4 pillars in the health sector, because data is cross-cutting in all other pillars. The country really appreciated the assessment that was done, the maturity assessment, and then based on those key domains and priorities, we had listed a couple of them here, 4 to be specific, that were dealt in details. One, the core team revitalization and strengthening. The second one is the issue of metadata cleanup on the DHIS2 platform. And then there was another key component that relates to data use across the subnational levels. And then the issue of data quality using the WHO data quality tool on the DHIS2 platform. And we would like to state that with respect to the core team, that is a very feasible and key activity for the country. And we were able to establish the core team that is cutting across all the disease program. The MIE office should with respect to different programmatic data, for example, immunization, TB, malaria, HIV, and a host of other programs, especially those maternal health programs. So that was done. And then we have also seen that it has very dear implications on the DHIS2 platform, because if we are able to cascade and then build their capacities, they will drive that process of issues around production of data, issues around even troubleshooting for their data quality with respect to their different domains or programs. The other issue that came out clearly is the issue of metadata cleanup with respect to the Nigerian DHIS2 platform, because it's a huge database, which most other countries I do not think have that level of data on the DHIS2 platform, because we are talking about presumably 39,000 health facilities that are currently on the DHIS2 platform. And then issues of tool modification also have implication on what the metadata is. And then some of those metadata are even beginning to be obsolete or some are redundant. And then we are beginning that process of cleanup, but that has not been completed, because we are feeling that if we ensure that we clean up or the metadata, That will improve the efficiency of the platform, and then we'll begin to have near accurate data in country. Then the issue of data use too is key, because this will, again, once you begin to use your data and then you are troubleshooting and then you are making informed data, evidence data decision, it will also allow you to do those quality checks that will improve the quality of data in the platform. And then we also are ensuring that all the state's MIE officers, the state HMIS officers, and the LG data officers or the LG MIE officers who are responsible, who are our focal persons that produce information product, particularly the fact sheets, the scorecards, and all those things, are adequately trained. When once their capacity are built, there will be efficiency, and then there will be productivity that will also lead to impacting the overall quality of data in the country. And then the other issue we have listed here is also the issue of data quality too. WHO has supported us to also to configure WHO data quality tool on the Nigerian DHIS2 platform. But however, there's still limited understanding of that tool and then limited use for that tool. So this is a feasible activity that will improve the overall quality of data on the platform. And then we also want to do an aggressive training of the states, national officers, and then the disease program to be able to own this tool and use it for their respective data quality activities. So there were also some challenges that were identified. For example, the issue of a concrete TOR for the next slide, please. TOR for the core team. And then we had articulated a budget that would make that activity driven continuously. But I know we conducted about 1 or 2 of those training, and then due to paucity of funds, that activity has been put on hold. But we hope that if this is reactivated, and then those trainings that were listed that should be quarterly are done, this will really build a critical mass of people in the health sector that will seamlessly drive the process. Then we also, like I mentioned before, began the issue of metadata cleaning. And then because of high attrition rate in the health sector, a couple of officers were transferred to some elevated, some transferred to other duties. For example, the director of planning there, Dr. Chris, was elevated to the position of a permanent secretary. And that somehow stalled that activity of metadata cleaning. And then for the gaps that were identified in the assessment, that also led to the development of a comprehensive concept note. And then we had a stakeholders meeting to create ways of strengthening the HMIS system in the country, particularly with respect to funding mobilization. We had that meeting, develop a roadmap or a plan to strengthen the HMIs. And then one of the key activities was to do a comprehensive assessment. But like I said, the director then was moved to a higher position, and then we have not been able to do that comprehensive assessment of our information system. Only pockets of fund surveys were done, which are not complete, and those ones particularly relates to facility readiness and service readiness and availability. We had also reviewed our data collection tools. We were using what we call version 2019, but in 2024-25, we reviewed those tools to be named version 2025. And this was also as a result of one of those gaps that we identified. that the tools were not comprehensive enough. Some of those disaggregations were not also very good. And then we've all taken note of that and then done them accordingly. And then new emerging issues were also incorporated. For example, issues around adolescent health, gender-based issue, NTDs, and a couple of other NCDs, eye health, all of these have also been incorporated in the new tools. So now we are just waiting for the launching and validation of those tools so that we can begin to deploy them across the country. So next slide. So with respect to challenges, I've talked about some of these challenges. One is continuity of this maturity assessment. I think it's a top priority, like even our Ghanaian counterparts mentioned, that if these assessments are more regular, then we should be having nearing perfection, so that even if this new administration come on board and then assessments are done within their regime, they buy in and then the commitment will be greater than what someone else did, and then you are just handed over notes to implement. And most of them do not show that willingness or that commitment to implement, and as such you begin to have issues around funding that are not very good. The other issue is also the funding landscape is shrinking at the day, and then some of these activities are also affected by this funding landscape. Though the funding we had from the GF was supposed to be like a catalytic funding, but when some other partners supporting the process or even the government funding is dwindling, then we begin to have issues. I've also talked about the issue of staff attrition, which is high and is making the projects somehow difficult to be sustainable. So those are the key challenges. There are more, but these are the ones we feel we should bring on board. And then the government is also mindful of this. And then the government of Nigeria is implementing what we call the SWAP program. That's the sector-wide approach in implementing projects where partners and all stakeholders now are almost bringing their funding to a pool, and then priorities are identified by the government and all the stakeholders, particularly the partners, key into that and then drive that process. We are also doing the process of annual operational plan, where the priorities are identified and every bottom-top approach is being undertaken, and then people identify their priorities, which are costed, and that now informs the annual budget in the country. Though most of these budgets still have limitation with respect to full-scale funding and then even the issue of releases of funds. I think those are the key issues that we are facing in the country.
Thank you, Mr. Bisong. And thank you to both our presenters for enlightening talks. It is very interesting to hear how your countries are utilizing tools such as the DHIS2 Maturity Profile to sort of inform funding requests and produce country plans. I think I will just on this. I think I would like now to give the word to our partners at Gavi and WHO to give a few remarks and views on the importance of aligning funding requests with the maturity profile and similar tools. So our first speaker will be Daniel Oyole. He is a Senior Manager of Digital Health Information at Gavi. Daniel, please go ahead.
Many thanks, Nina, and good day, everyone. Confirm you can hear me okay?
Yes, we can hear you fine.
Great. So many thanks to Nigeria and Ghana for sharing their perspectives. I think it's quite enlightening, and it just shows how practical the maturity profile as an output, but the exercise as a process is for countries. And I'll be, just sharing some reflections from an investment or from a donor perspective, how we view this exercise. At Gavi, we have an intentional shift, and we are saying that digital health investment needs to be informed by national strategies and assessments, and one of which is the DHIS2 maturity profile, the process and the documentation. Again, this is something that we see as valuable because if you look at the process, it's one of the very structured approaches or framework that really looks at foundational health information systems and investment. And from our, what our collective experience during the pandemic, we saw how resilient the systems that had, or the countries that had functional DHIS2 systems were able to, how resilient and how reactive they were compared to countries and systems that were not so mature. And we do see how this assessment, plays a critical role in shaping the funding requests that comes from countries and ensuring that all partners are aligned. For Gavi, our goal or our target is to leave no child behind with immunization. But then in many countries, as we have seen, health information system is not siloed, and it's not speaking to one particular program. And there's a saying that if you want to go far, you go together. If you want to go quickly, you go alone. We have seen how, before now, we've had information systems that go alone and end up breaking down midway. And we have seen the value addition of going together. And this is one of such opportunities that we need to leverage and make better use of the DHIS2 maturity assessment as a process, as well as the outputs from this exercise. Next slide. So I just wanted to highlight that the maturity assessment process is not standalone, and it's not just done in silo. Many organizations, Gavi inclusive, have different approaches to supporting countries, and coming from a broader digital health perspective, not just health information system. There are lots of tools, but I just really wanted to flag that the the DHIS2 maturity assessment process actually feeds into a lot of approaches that are being, supported by partners, by donors, to help us know where to invest in. And one of these is the National Digital Health Information Costed Country Roadmap Toolkit, which Gavi launched in 2022. This helps us to cost and time digital health interventions or solutions, especially as it relates to interoperability with the broader health systems. And we see DHIS2 as the backbone of health information system in many countries, of which most of the health data sets are domiciled, and it's critical to the broader digital health plans in many countries. Next slide. So how we see this, we view this more of a complementary lens than competitive, because on one side, we have the DHIS2 Maturity Profile, which is the assessment we've all been referring to. We see how it assesses foundational domains, be it tracker, aggregates, mobile, and as the case may be. We also see different modules for different programs, as well as the triangulation of these data sets and generation of insights. We've also seen how these have been designed as a check, sometimes annual, sometimes at a less frequent manner, where we are able to see from one point to the other how countries are doing better or not, and how this exercise produces a prioritized list of activities to strengthen DHIS2, which also in turn contributes to the broader health system strengthening. On the other lens, I picked something that's quite complementary, which is the digital ecosystem maturity. We often view the GDHM, which tracks countries across different phases. And also it evaluates across 7 enablers from governance through to services or implementation, how well the country is mature for digital health interventions. And you see, these are very complementary, and it helps us to paint a more understandable picture of the ecosystem. We are able to track what is used, what is not used, where we have redundancies, where there are some coordination gaps, and then most importantly for the donors, that the list of prioritized activities and how these activities link to the enablers of the ecosystem, for us to know what we are investing in, why we are investing in, and the expected outputs of those investments. Next slide. So, as I said earlier, our approach encourages addressing fundamental gaps and mitigating risks before scaling or deploying advanced systems. We want to meet countries where they are and then support them. And we have, quite a lot of examples where it's more profitable and more value for money to fix issues around governance or around health workforce or around the system architecture. Sometimes, there is the misconception that once you have money, the problem is solved, or once you provide funding, your gaps are addressed. But that's not the case in many instances. We need to really understand the context, understand the bottlenecks, understand the ecosystem, what are opportunities and what are threats, and this as a precursor to requesting for funds, as a precursor to developing operational plans, have been found to be very, very effective for many countries that we support. Next slide. Yeah, and I think I would want to round up by saying that beyond just the output or what is seen or the processes, I think when we understand that this is a key input for other processes, it also incentivizes conducting this maturity assessment in more detail and with more enthusiasm, knowing that this investment or this exercise actually helps with aligning donor investment, so that where joint investments can be done or where complementary investments can be done is very clear and well articulated. they also provides an opportunity to align around, most of the enablers, as we can see that the process really is heavy on nationally owned discussions and validation of priorities. And then, these stakeholders can also provide the necessary governance and coordination. And we find that to be very, very critical in as far as sustainability
Did we lose you, Daniel?
Yes, I got cut off for a bit, but I'm back.
Okay.
And yeah, maybe I'm talking too much, which is something that I do a lot. Finally, I would want to say that the output serves as input, which is critical for us to understand for other sectors, and specifically the broader digital health ecosystem. And it would be good if we look at it as both an advocacy tool, a planning tool, and inputs for coordination and synchronization of efforts in countries. And I think viewing it from that lens will really help us, as they say, starting with the end in mind, to put all these efforts and to understand why we are making all of these efforts in the maturity profile development phase. So I just wanted to share these, few reflections on how we see this exercise. As much as it benefits the country, it benefits the donors, it benefits all the stakeholders that are involved in digital health and HMIS space. And I think that when well done, it makes our lives much easier as far as strengthening health systems in the country. I'll stop here and happy to share more reflections as we continue. Thanks.
Thank you very much, Daniel, for your insights. I think I will then move on to Anshu from the World Health Organization, WHO. She is a HIS technical lead at WHO, and yeah, I'm excited to hear your reflections as well on. So please go ahead.
Thanks, Nina. How much time? I'm just also aware of the time, so I'll try to be very brief. And good afternoon, good morning, everybody. So I will just start with this. I'm sure everybody is very familiar with the Routine Health Information System Toolkits, which is one of the beginning products of a very broad and effective collaboration between WHO, the Health Information Systems, the Global Fund, Gavi, and also the University of Oslo and the DHIS2 community. This has been one of the areas of work that has been well implemented through the support of partners, Global Fund, Gavi, and others, but also by the technical assistance and support of the DHIS2 community in many countries. So, and I'm also very happy to hear that Ghana now also uses the WHO data quality toolkit as one of the core components. All of this work is embedded and built in with the DHIS2. So it's aiming at enabling the implementations. But what is the main purpose behind that is also to try, next one, to try to avoid any silo, any overlap, but trying to bridge and bring the data of different programs together, making the HIS2 as the core national HMIS, which is the core platform for the country to bring the data together to analyze data and generate different visualization and analytics that is useful for the service, for the management, also for the planning and for the policy. And last but not least is to build the capacity using all the different standards, and a lot of the tools also have the capacity building training materials come along, and the data quality. Next, please. And as a result of a period of implementations, and we together develop what we call the strategy for optimizing the national routine health information systems, where the very much concept is officialized and highlight the importance of sharing data, of sharing common standards of capacity, but also what is important is to bring in the role of the governments in overall seeing the health information systems, investing in it, and maintain the capacity. It is a challenge, and we'll see there are lots of the cost. Ghana has given a very good example of the costing and how it can be, how much it would be needed to maintain, let alone the strengthening of the health information systems. But we also highlight the importance of having the role of the government in the data governance, in management of the data quality, and assuring the infrastructures, and mobilize and maintain the relationships and the commitment with the donors and with the Ministry of Finance as well. Next, please. So there are 5 key objectives. I will not need to repeat this, but mainly is the standards, the governance, the capacity building, and the strengthening of the digital capacity. So to make the data shareable, to make the data exchangeable, and to have interoperable software and different systems. At the end of the day, we want them to talk to each other. We want the data is going to be optimized and used at the maximum. Next, please. Next. One of the byproducts of this is the readiness assessment for the implementations of that. The reason I bring this up because it is the first step that linked to the DHIS2 Maturity Assessment. We work on this together. It's just the timing was really perfect. So for country that starting the implementation of the toolkits, we have this readiness assessment. But then when we have in DHIS, the DHIS2 can pick it up and see where they are, and where are the gaps, and the reminder of seeing the routine health information systems and the HMAS as a one continuing evolving ecosystem that need constant checkup, investment, but also to see where we need to update and filling in the gaps. Next. And that link to the tools that you're familiar with now, and we have the foundational part, which is very much of the first strategic objective of the strategy. But then it comes with the common HMAS, where lots of data that need to be in place, in the same place to generate the national health statistic report, for the facility to manage the services, and then also for the program specific, where we have different programs. So I do not need to say more about this because I'm sure it has been mentioned. Next, please. Just a highlight here is the foundational. I think this is very unique of the DHIS2 Maturity Assessment, where we normally we look into things that normally overlooked, and this is where the call for the government is really important, because it is not a single partner or single stakeholder can be responsible for this disease, where the governments can be the convening roles, can be the place where we can bring the investment, but also to see how data is collected, shared, and used in the countries. And it's really nice to see, this example from Nigeria and Ghana. It's different, but at the same time also to see the roles of these areas that get attentions, and see how we can continue to mobilize funding and support for this. Next. Just a quick reflection. I've been following this, both the implementation of the toolkits, the data quality, but also been involved in a couple of the sort of the result sharing for the assessments, the strengths are there because it has been aligned with a lot of the global tools, and one of the bigger tools that I mentioned later is the WHO score for health data technical package and assessment, which is we are just wrapping up the second round, and I'm sure all from the country offices and the ministry have been involved with that, and it's very much aligned with that as well. The strong point of this exercise is it's very much country-led, where we highlight the importance and the role of the ministries and other governmental sectors. And we have the foundational components. Also, the country engagement, partner engagement, and bring it in. Ghana has given a really good example of how you translate the finding into the proposal for the next grant, but also to see how we can bring it into for other partner in investment as well, and see how we can prioritize the capacity building plan. But what we can also do better is that, and Daniel also mentioned, is to see the HIS2 as a core platform for the HMIS. It's a very much of an analytic platform to generate health statistics based on routine data. But then now with a lot of countries are moving toward digital transformation, bringing in a lot more digital tools, looking more into the patient-centered approach into data collections. Whereas we need to see the role of the HIS platform on the connection to that. Keeping in mind that it is a place where the data can come in for the analysis. The dashboard is going to be used across the health system and the health services. So the importance of, what are the best essential requirements, and one of that is also the digital health monitoring platform that Daniel also mentioned is one of the area. But then a lot of tools that we also need to see to make sure that we are not just look inward into the DHIS, but also to see where the DHIS platform is in the national health and the national data ecosystems, so that we will not going to be siloed as a one system itself. And I know that there's lots of work has been done in that, so maybe this is something that refer to the HISP center to see how we can update and to make to update the tools a bit. And then in the process, I think I will never highlight enough the importance of the leadership and of the ministry, but also to see where it's important to use it as a tool to mobilize funding from partners, but also as a tool to mobilize the funding from the governments. Even it might not be a lot, but it is important to have a budget line for HIS in the strategy and in the planning for health. And also I just quickly saw in the updates earlier that like health information systems strengthening is one of the core today in the UN Statistic Commission meeting in New York that is going on at the moment. So again, the health information system is important, is highlighted, and then we need to see how we can together with the partner to make it into something that is sustainable and stay on forever. And then with that is one of the key points, also the capacity building, and Nigerian colleagues also say one of the key part is how we maintain the health staff and update and upgrade their skills. So that it doesn't matter what are the key finding and how much we're trying to improve, but where there is a role of the ministry, where it is ownership, and I hope that this is going to be the part of the discussion after the score assessment, as how country going to strengthen the HIS strategy. Next, please. And this is my last slide, actually, is the score assessment report, where we look at the entire the health data ecosystems. The routine and the toolkits that go into the surveillance, go into mortality and cause of death data, go into facility data, going into the data analysis, the skills in the countries, as well as the data governance, the data sharing mechanism. So this would be by June, we should be able to release a result for each of the country and identify the gaps on that. And this would be a perfect opportunity to work and align or use the finding from the DHIS2 Maturity Assessment to be able to inform the ministry and in-country partner to see how we can, identify further area of gaps and investment into that. And as the WHO, we would be more than happy to continue to support this process, both in terms of strengthening the routine health information system through the maturity assessment, as well as the use of the score and the available support to make sure that the priorities are there, are aligned, and then there is a strong case to mobilize funding from all different partners and from the Ministry of Health. And I think with that, I will stop here and thank you very much.
Thank you very much, Anne, for your insights, and thank you everyone for your great presentations. We're very glad to hear the experiences of the countries and the reflections from our partners around the need to co-invest and to cooperate for investments in country, and Dr. Sala's points also to use the maturity assessment in sort of new funding cycles and their experiences having used it in the previous Global Fund grant cycle. I think then I would like to open the floor for questions. If you could please raise your hand if you have any questions, or write them in the chat. Yeah, the final slide here is just some additional resources. This recording will also be published on YouTube, on our YouTube channel after this webinar today. And we will also make sure to include any relevant links in the text there. Okay, so I think I will address the first question. It comes from Christina Luciana. She's a health specialist at UNICEF HQ. I have a question for our colleague from Nigeria. If the Global Fund funding was catalytic by design, do we know what were the barriers that undermined the transition to institutionalization of funding? Was it political will, fiscal space, or lack of local ownership during the funded phase itself? Thanks. Mr. Bisson, would you like to respond? Mr. Bisson, are you still there?
I think
Aluka, do you
Bison is here. Yes,
Yeah.
I can.
Is there now?
Thank you, Bison. Thank you. Yeah. Let me throw some light. Thank you very much. I think it was neither political, no, it wasn't political at all. Just like what Bison said, it was like a shift in government, because the director got promoted to the rank of the permanent secretary, which he couldn't hold that position as at that point. And he was actually very passionate about the system. He actually brought in quite a lot of innovations, like the issues around the co-creation, bringing in all partners for a 2-day workshop to be able to come up with plans. But you see, Once he left the seat, that's where things went snowballed into inability to continue with that process. So it wasn't political at all. I think just like it's been recommended, continuous looking back at the maturity assessment puts countries into very good perspective to have that level of continuity. And I think that is the message that we will be taking home, that let there be that level of continuity even when new governments come into place. Thank you.
Thank you, Luca. Then I think I will move on to Bruno Akpakupo. Hello, everyone. This is Bruno, RSSH Implementation Specialist at Global Fund. Thank you for the excellent presentations for Ghana and Nigeria. Given the increased budget constraints, which DHIS-related activities currently funded by partners could be gradually transitioned to government financing? Perhaps Ghana would like to respond? Dr. Sala, are you still there?
Yes, I may be able to take that.
Yes, thank you.
Yes, thank you. Yes, so I think largely considering our state as far as the HIS2 implementation is concerned, our major area of support from partners these days is in the area of server resources. There are in-country processes that are currently ongoing to see if the National Information Technology Authority, which is we call NITA, will be able to house some of our less busier service as a gradual transition to using in-country hosting services are being exploited. The advantage or the disadvantage have largely been the stability of the service. And so it is something that is in active discussion on how to have a more sustainable server arrangement where we don't have to depend on partners to be able to secure funds for server subscriptions. Beyond the server, the rest of our investment areas have largely been in the area of improving data quality and data use, and also the capacity builders, which are things that we are trying to institutionalize and begin to use local budgets to run. And so I believe that in the coming grant, for instance, a lot of emphasis will begin to shift towards sustainability and data use areas, and also in the area of climate change, because the ministry's strategy when it comes to climate is being centered around the capacity that we have in DHIS2 platforms to be able to deal with climate and health. And so majority of the direction that we will still be going for partner support will be in that area. But a lot of the implementation that, for instance, we did in GC7, we will look to try to sustain that using local resources and all that. Thank you.
Thank you, Oswald. Perhaps Nigeria also wants to reflect on this. Aluka or Mr. Bisson?
I think Bisson can go for it.
Please, Mr. Luka, I didn't hear the question. What was the question?
For Ghana and Nigeria, given the increasing budget constraints, which DHIS-related activities currently funded by partners could be gradually transitioned to government financing?
okay, the issue of even the DHIS2 platform server hosting, it has also been supported majorly by partners. And then we feel for ownership and sustainability, this is a key component that can be transitioned to the government funding, and then government take ownership and funding for server hosting, and then eventually server management after the capacities have been adequately built.
Great, thank you, Mr. Bisson. Then we have another question from Jonas Mwale, requesting reflections from both Ghana and Nigeria. Leadership and governance is a critical issue, so I would like to learn what challenges were faced with getting coordinated efforts by sector players, and what did success with core team revitalization actually look like. Oswald or Dr. Sala?
Yes, so thank you. So in terms of governance and leadership,
I'm sorry, Dr. Sala, you're breaking up again a bit.
Like we all have seen, there's a critical gap to. Sorry, can you hear me? Can I be heard?
Yes, I think
Can
so.
I be heard, please? Is it better?
I
Yes.
think so. Please
So
go
in terms
ahead.
of leadership and governance, I think it has been one of our constant gaps. And I think one of the major issue is actually the involvement of the technical team in that level of governance. And one of the major issues we've had is sometimes a lot of frequent change in leadership. But I think that moving forward, one of the critical things that the maturity assessment tool identified was the gap in our governance structure when it comes to health information management system. And that actually was inputted into the strategic plan as one of the key priorities of the service. So I believe that moving forward, it will be something that will take steps to ensure that that gap is actually closed up as much as possible.
Wonderful. Thank you, Dr. Sala. Let's give the word to Nigeria then. Mr. Besong or perhaps Luca? Mr. Besong, would you like to respond? Or Luca, if you're still here. No. Okay. Any other questions? Please raise your hands or write in the chats. Otherwise, I think that is it from us. We can end 5 minutes before time. No? Okay. Great. Thank you so much, everyone, for joining us for this webinar today. We will, as I said, post this, upload this recording to YouTube, and also include the links that you can see here, links to the maturity assessments, and other relevant links that has been to other things that has been mentioned today. Thank you very much to all our presenters, and I think that was it. Thank you, everyone. Have a great day.
Thank you.
Thank you.
Thank you.
Thank you. Bye.
Thank you. Goodbye, everyone.
Thank you. Not the
Thank you.
Okay, many thanks.
Thank you. Goodbye, everyone.
Thank you. Goodbye.